Okay, well, welcome everybody. It's 12 o'clock p.m. Eastern Time. Thank you so much for joining us. We're incredibly excited to get started on today's Health Standards Organization webinar on climate action. Before we begin, I just want to acknowledge that Health Standards Organization's headquarters are located on the traditional, ancestral, and unceded territory of the Anishinaabe Algonquin Nation. We are incredibly honored and fortunate to be able to support health and social service organizations across the globe, and just want to acknowledge the diversity across the globe in all the countries that we're able to support with quality and safety opportunities. So just want to start off there. Now, as many of you are aware, you signed up because you're very interested to learn a little bit about HSO's role when it comes to climate action. Earlier this year, HSO released its declaration on climate action, and we're very excited to unpack exactly what that means and what that will look like moving forward and what HSO will be contributing. And that's exactly what you're here to learn about today. So, just before we begin, a couple of housekeeping notes. There is simultaneous interpretation available for today's webinar. If you look at the bottom bar, you should see an opportunity to do so. Please feel free to click that if you prefer to attend and participate in today's webinar in French. And thank you to our translator who is providing those services for us. Secondly, there is a Q&A feature. So as many of you know, we will have the opportunity to answer a couple of questions that you may have. I highly recommend and encourage everybody to please use that Q&A function to ask questions, include your thoughts and reflections. We'd love to hear from all the panelists that are joining us across the globe. So please feel free to use that Q&A function at the bottom. And probably the question I get most of all is, will this session be recorded? I'm glad to say that yes, everything will be recorded here, and that recording will be distributed to all registrants. For those who can't attend, they'll receive a copy of today's webinar as well. Okay, that's all the housekeeping. Now let's get into the main content here. It is my pleasure and privilege to be able to introduce today's keynote, Leslie Thompson. So if you don't know, Leslie is the Chief Executive Officer at Health Standards Organization and Accreditation Canada. She works as an executive in residence at the Rotman School of Management in the University of Toronto and focuses on strategy and change leadership. A passionate champion of people-centered care, Leslie began her career as an intensive care unit nurse and has 30 years of experience as a senior executive in hospitals, health systems, the government, and a global medtech company. She has also served on multiple public and private sector boards, including the International Society for Quality in Healthcare. It is my privilege to introduce Leslie Thompson, our keynote for today. Leslie, over to you.
Thanks so much, Vishal. I'm absolutely delighted to be here today. And what I hope to do is really set the stage for an ongoing conversation with all of you. Thank you for joining. Next slide, please. HSO and Accreditation Canada, we together are united in a bold but, dare I say, achievable vision that is all about working together for safer care and a healthier world. And together with our incredible staff and surveyors, expert advisors, and partners, we are empowering and enabling people around the world to continuously improve quality of care. That's the mission that gets us up every day and what keeps us focused on what matters the most. As a global enterprise, we work with people in over 40 countries across 14,000 locations in 5 continents, and we see challenges of today and as well as understand the forces of change that are impacting our collective ability to achieve levels of quality that our populations deserve. And as I travel, I have conversations with so many leaders, policymakers, and providers and patients around the world. And it's amazing. Sometimes if I just close my eyes, I'm one part of the world, I'm immediately transported to another where the challenges are almost identical. Local context matters, and it's clear that as we tackle these big issues like climate change, solutions also need to be tailored to the local conditions and unique needs of countries and cultures. But there's so much that we can learn from each other to speed up the translation of knowledge and sharing of resources so that practical steps can be taken toward common goals. I feel so privileged today to be among so many experts on the topic of climate action. I consider myself still very much in learning mode and a novice compared to so many of you. But I know that for all of us, the more we learn, the more confidence we build in being able to contribute to this mighty challenge ahead of us. And it's great to see people from across the country and around the world come together with clarity of purpose, determination to make a difference, and willingness to work together on something that is so much bigger than any of us could handle on our own. Next slide, please. The climate crisis is real. The health of our planet and people around the world are literally at stake. Reports of the magnitude and impact of the crisis are so much more than we can count, but for many of these, many people, and for many around the world, this has become also deeply personal. And for those of you who are participating today that have been on the front lines of the crisis, we extend our heartfelt gratitude for the work you're doing on behalf of others. And for those whose lives or work and communities have been impacted, we are deeply sorry for the losses you have experienced. You know, I was reminded in a conversation with Susan Brown, who's CEO, when I was visiting her in the north region of Interior Health in British Columbia. And I remember her saying nothing has prepared her for the kind of leadership that was required to deal with uncontrollable climate events, evacuating remote communities, finding ways to get staff safely to work so patients can continue to be served, preparing for the next flood or fire before the other one was even done. She's doing a remarkable job, by the way, along with her teams and the community, and it's inspiring to see this leadership. But what a challenge it all brings for her and for others. And we know that responding to crisis is only part of the challenge. How do we prepare? How do we prevent? What can we do as individuals, organizations, and coalitions for change to make a difference in what seems like an overwhelming set of conditions? We know on the other side of the equation that the healthcare sector, we're trying to solve problems that we are contributing to ourselves. We are the 5th largest emitter of global greenhouse gases on the planet globally. And it's a stark reminder of our dual responsibility to be both protectors of health, as well as knowing that we are contributors to the crisis and need to take action on that front as well. Hospitals and healthcare facilities, as you well know, require vast amounts of energy and electricity for lighting, heating, ventilation, water use, medical equipment, and a lot of organizations still rely on fossil fuels. They also generate lots of hazardous waste. Our supply chains and transportation logistics contribute to carbon emissions as well. The list is long and daunting to try and solve. So I propose we look at this challenge overall from two perspectives. One, this is about people first. How do we protect health as the effects of climate change intensify? And second, what can health systems do to reduce their carbon footprint and become part of the solution? The urgency is real for a coordinated collective effort and a challenge we must face together with resolution, innovation, and action. And that's one of the reasons why we're all here today. Next slide, please. While today's purpose is to go deep in the climate change topic, I wanted to just step back and make sure that we were also looking and understanding a climate crisis within the broader context of healthcare quality. When we look at the trends and issues that are shaping the future of quality, kind of come up with thinking about this as quality 5.0. What is this next era of the big challenges that need to be faced? And none of them are isolated. So when we talk about climate, it's deeply interconnected with the other major challenges that impact quality and safety in health and social services. First, on the global workforce, there is no quality without a healthy, competent workforce. And workforce is directly tied to that organization's safety culture. And if people can't get to work, if services are not available in relation to some of the climate crisis, nor are people equipped with the knowledge and skills to be able to handle some of the new challenges that are emerging, then that is contributing to the to the challenge. Health inequities are a long-standing challenge that directly affect access and quality to care, and climate change exacerbates these disparities in very profound ways. The climate crisis affects us all, but not equally. And so we need to be finding ways of actually how do we link the notion of climate crisis to these other dimensions of quality. Fragmented care is a global issue leading to harm and transitions when silos aren't connected. And we have to plan thinking about full populations and communities as opposed to care that happens in buildings and institutions in order to really make progress. And avoidable harm has increased since the pandemic, reminding us that patient safety has to be put back on the front burner of attention. And we're really fortunate that the Global Patient Safety Action Plan and positions of ISQA, the International Hospital Foundation, and others are all putting major attention on the importance of addressing climate crisis as part of the quality agenda. So now let's look back and zoom back out in onto the climate change with the next slide, please. Like many of you, we've had this on our radar for a while and working on ways that climate action can be addressed within the tools and the resources and the levers of change that we have at hand. Standards are a really powerful enabler of change because the language matters. And we know that people spend time, energy, and resources to meet the standards. And so that means that we have to get them right. And we do that through a process of extensive collaboration, update of evidence, knowledge, and expertise from so many folks around the world. And so one of our early steps, just by way of background, is to update the language in the governance standard as it was being released in 2022. And that sets out explicit accountabilities for organizations to meet that are tied to criteria around responsibility and accountability for environmental stewardship, and for organizations to take steps that demonstrate ways that they are reducing their carbon footprint. When this came in 2022, this is a start. And we know that clients are already being assessed against this criteria already. It's a first step, but one that we think is already making a difference. And now it's time to go deeper and include language that will transcend other standards as well. So in order to organize and think about what is all the actions that we need to take and which are the ones that are going to be most influential in the future, the next slide shows our declaration on climate action. So on this, the HSO board approved a declaration on climate action in August 2024, and we shared that publicly with all of you in January of this year. This is a big deal. My signature is on it as the CEO, and our entire team is dedicated to bringing it to life, from the board to the front line of folks within our own organization that are working across HSO and Accreditation Canada. We took a similar approach with the use of a declaration in addressing Indigenous specific racism by making it very overt, very deliberate to advance cultural safety and humility. And we found this was a great way to hold ourselves accountable and others around us in what we intend to do. And it helped to articulate the path that we're on. We constantly go back to it. How are we doing? Are we able to uphold the commitments that we said we would? What are we learning? Where are the challenges? And this really is helping to shape the way it's going forward. This declaration is a commitment to action. It is not hand waving. It's not pointing at everyone else to solve the problem. It's not words that anyone could say. It's actions that we as an organization can take and are going to take to bring this commitment of climate, our contributions to climate action, to life. We're embedding the language of sustainability into standards, into the criteria for assessment programs to ensure the climate action becomes a foundation of how health systems operate. This is new, and this is going deep when we look at everything from our safety practices of medication management to the governance of organizations in terms of their stewardship for the future. We are taking steps to address changes that are possible within each of the levers of change that we have. And of interest. There's the standards I've spoken to, the assessment programs. We're contributing to capacity building and with our surveyors and others who are working with us. But the one actually I feel is also going to make a very big difference going forward is the commitment to take a stand. And that's about leadership and taking a stand on issues like climate action that are important and working in partnership with so many of the others that are stepping up and leading in the whole field of climate action and climate change. So let's look at the declaration in just a little bit more detail. The declaration outlines 9 key elements, and today I'm just going to highlight 4 of them for you that are here to as examples of the kind of work that is going to take place. So momentum is already underway, and you can see we've established an advisory committee on climate action, and we're going to introduce them to you today, and planetary health leaders. We're developing and embedding these more explicit criteria in our standards so that they can have greater impact on addressing climate change in very explicit ways. We're exploring ways to recognize and celebrate exceptional performance and partnerships in green healthcare by providing a model for others to follow and fostering a culture of innovation. And stay tuned for this one. I'm quite excited about it. And we're also collaborating and contributing to climate action research so that with proposals that are aimed at closing persistent gaps and to help advance evidence-based approaches to sustainable care, because as research comes, then that feeds back into our standards and programs. So we want to contribute both as on the development as well as on the use of new evidence. And so this is our roadmap for action. It reflects our commitment to working collaboratively across sectors. There's so many folks in the field already that are working and contributing in major ways. And we are so pleased and proud to be joining uh, um, the work of others and to play our part in contributing to broader change. And that means across Canada as well as around the world and globally. We need each other. So with all of that, I am delighted to introduce you to the members of our Climate Action Advisory Committee. This is a group of exceptional leaders and experts who will guide our work in addressing climate action through our levers of change. The team has got such a great diverse range of expertise in sustainability and healthcare, and they also will be reaching out to others. Not everything's going to be happening within this one group, but connecting with others so that there'll be opportunities for you to be involved, to contribute your voices, and as well, because listening and learning and engaging will be part of the work. This is not going to be easy. The list of what we should and can do is much bigger than what we can tackle at any one time. So it's going to be key. We're going to depend on this amazing group to help us set priorities, focus, and identify the things that are going to make the biggest difference. And so that is, this is a really important steps. And I'd personally like to thank each and every one of you who are on the committee. And I hope many of you are here today, and to those who will be working with them. And with that, I'm just so, I know we're so fortunate to have Dr. Miles Sargent, the Executive Director for Canadian Coalition for Green Health Care, co-chairing this team along our own HSO leader, Vishal Jain from HSO. We are really proud to be working with such a passionate and skilled group of leaders and taking meaningful steps together to help build more sustainable, resilient, and people-centered healthcare systems. Vishal, back over to you, and I look forward to the conversations and the learnings ahead.
Thank you, Leslie. I appreciate you setting the scene and framing up exactly how HSO and Accreditation Canada will be contributing. I think it's very vital for us to be able to situate our declaration within the broader context, both for Health Quality 5.0, but also within the climate crisis and how it's impacting health and wellness globally. So Leslie already mentioned our next speaker, Dr. Miles Sargent, who I'm very fortunate to co-chair HSO's Climate Action Advisory with. But Dr. Sargent wears many hats. So Dr. Sargent is a family physician who has worked with vulnerable populations, including new immigrants and refugees, people experiencing homelessness and or addictions, and the elderly for over 25 years. In 2023, Miles became the executive director of the Canadian Coalition for Green Healthcare. He also serves as co-founder and co-lead of Partnerships for Environmental Action by Communities Within Healthcare Systems, otherwise known as Peach Health Ontario. Miles is also an assistant clinician professor with McMaster University. So, I'm not going to speak any more about Miles because he is going to be spending the next 10 to 15 minutes with all of us talking a little bit about his commitment to this work, his approach to this work, and what he is seeing on the horizon when it comes to climate action. So with that, Miles, I'll turn it over to you. Thank you so much for joining us on today's webinar. Over to you.
Thank you so much for having me, Vishal, and thank you, Leslie, and thank you to HSO for asking me to co-chair this incredible group. Today, I will be talking about climate change. I'll be talking also about a bit about the history and role of the Canadian Coalition for Green Healthcare in this space, and I will talk a bit about my own motivation, how I got here today. And yes, as this slide tells us, the climate crisis is a health crisis. Next slide, Vishal. So these are photos of disasters in Canada over the past few years. There are many others that we have not added here. We don't have hurricanes here. We do have a tornado. We've got a flood. We have heat. That's a major one. And of course, we see lots of fires. Climate change and healthcare are intertwined. Healthcare generates greenhouse gases. We have an oversized carbon footprint. And then GHGs, or the greenhouse gases we produce, in turn impact our health. So how can we create less greenhouse gases in our sector? And how can we also be prepared for climate change, both as clinicians and as healthcare systems? Next slide. I love this slide. This is done by Dr. Jonathan Patz from Wisconsin. Essentially, he's put global warming in the middle and the immediate impacts of global warming in terms of rising temperatures, weather extremes, and rising sea levels. And as you radiate outwards, you see the impacts on human health. I have added a Canadian context here. This does fit for every country, especially the inner circle there. The outer circle is more of a Canadian context. And as we're learning in Canada, if we start at 12 o'clock, air pollution, we have air pollution from the burning of fossil fuels. And in Canada, we certainly have the problems in terms of lung disease from fires, from forest fires. And forest fires do produce extremely small particulate matter that does get into the lungs of both the young and the old. It is a big problem. Then we see in the yellow section there that is the vector-borne diseases. So in Canada, that is mosquitoes moving further north, carrying diseases further north than they used to. West Nile virus is one. And also in Canada, the tick, which used to be in a very small area on the north shore of Lake Erie and is now quite prevalent across provinces in Canada, which causes Lyme disease. I'm going to jump down, because I only have so much time, I'm going to jump down to environmental refugees, and I think a lot of us are probably feeling the pain of some of the people in the States right now who are being essentially shipped back home. This will be a problem moving forward. The global north, like Canada, we do produce CO2, and then other countries suffer more than we do. Mental health, obviously causing climate anxiety. My talk doesn't help with that much, I'm sorry. But yes, climate anxiety is a problem, climate grief, particularly in our young people today looking at their futures. And I'll jump up to heat. Heat happens to be the #1 cause of death in Canada as a climate change disaster. And you may not know that it's typically the elderly, people with comorbid illnesses, who are actually in their homes when they become overcome with heat, and finally severe weather at the top. Next slide, please. So this is Trevor Hancock. When I was in medical school in the 1990s, we were learning a lot about the social determinants of health, the concept that our health is impacted in a large way by things like our income and our education level. And so Dr. Hancock is speaking to this here. This is a quote from a public health journal. He is a family doc and a public health doc. This is from 1999. And the piece here, which is interesting to me, is that he's talking about the environmental determinants of health here, which was not something we were talking about so much. So you will not be surprised if he's saying this in 1999. It was the next year, 2000, that he co-founded with Kent Waddington, the Canadian Coalition for Green Healthcare. And I would suggest that climate change has made some of the disparities of health, both for individuals and communities, has made this worse. Next slide. So bringing this home, I'm from Hamilton. Hamilton, for those of you who don't know, is kind of halfway between Toronto and Niagara Falls. We're within an hour of each of those places at the end of the lake. And we were at one time a very industrial town, less so now. This is a study that was done based on data from around 2006 to 2010. And this looks at health outcomes for people in different parts of town. You don't want to live in the red areas. This is called the Code Red study. The red area there, which is adjacent to the lake in blue, is an industrial area. The poverty rates are higher, the educational levels are lower. This is a lung cancer slide. They also had a mortality slide, which actually showed that the people in the red areas of town die 5 years earlier than the people in the green areas of town, and the green areas are only 5 to 10 kilometers away. Next slide. So we're zooming in a little bit here. There are some truisms from this slide, things like the wind blows typically from the west, and so east ends of the city often are have more health problems. And you can see beside the black highways here in some cases that the red and the pink zones are often to the east of the highways. You don't want to live near a big highway. Those are the black areas, and you don't want to live downtown. So yeah, and of course the highway, that's another fossil fuel burning issue. So this we've added on here are shelter clinics. So as I may have mentioned, I do work with people who are underhoused or homeless and have for years, and we have set up shelters all across town, and most of them are right in the heart of this Code Red area. And I think what motivated me, and I still am interested in this patient population, but there was a day at a shelter clinic that I was working that was extremely hot, unusually hot. We were seeing these heat changes, obviously, in the late 2000s. And the air conditioning was broken, and I was sweating like you don't want to sweat when you are a professional, and the patients were sweating. And what was the big difference between me and the patients is that I was driving home at the end of the day to the suburbs, to the green area, to the trees, to the air conditioning, and they were not. This was not recognized as a big problem 15 years ago. We now know there's a lot of cities in Canada that are making bylaws that landlords need to be sure that apartment units are less than 20 to 26 degrees at night. And we're also seeing this within healthcare facilities in Canada that we're not prepared for the heat. We need to be ready for the heat. Next slide. So what do you do about this big problem? Well, a few of us started a tree planting program in Hamilton, and it's now 12 or so years later. We've done 90 community plantings. We've done a bunch of plantings at the Hamilton General. That's why this slide is here. I suppose you could say at that point, at the hot day, I kind of swapped my stethoscope for a shovel, not completely. And the goal, of course, was to improve human health by planting more trees in the inner city. These kind of plantings today are called tree equity plantings. These are also done, obviously, for carbon mitigation, decreasing, trees help to decrease CO2 levels. Trees and grass also help create a sponge for floods. And so there's lots of benefits to planting trees. It takes time to plant trees. Hamilton General is actually in the bullseye of that code red area I just showed you. So what is the problem with this photo? Why are there so many trees? It's because, as you can tell from the architecture, this slide is from 1910. This is the Hamilton General in 1910. The trees are largely gone. I think we've all done this to our cities. We're trying to plant them back again. Next slide. So as much as I do feel we've done a fair bit for our own community in Hamilton, and it's important to do these tree plantings, I do read the news, and I am aware that for every acre we plant in Hamilton, there is over 1 million acres burning in North America. And so there needs to be a bigger solution here. And so what do you do when you have a big problem? You call a friend. Next slide. And so I reached out to Linda Barangu, who's here today, who is a mentor of mine. And I asked her, how can I, if I'm going to put time and energy into this, how can I have a bigger impact? And she suggested that we look at the sustainability of the healthcare system, which she'd been doing for 25 or 30 years already. Together with a few people, we created this vision of an ideal green facility. You obviously want to start with a vision. And we think about how can healthcare produce less greenhouse gases? And also, how can healthcare adapt to climate change issues such as ticks and fires and grief? And how can we have resilient structures, hospitals, and systems that can withstand these disasters? So it is a big challenge. And so we can also look to friends in other countries. Next slide, please. We can look to the global south to learn about resiliency. They're far ahead of us in that area. We can also look at other countries that have done a lot of academic writing on this. This is from the Lancet. This is England's healthcare system. This is all of their healthcare system combined: ambulance, primary care, dental office, hospitals, blended in together here. This one kind of blew my mind a few years ago when I first saw it. Surprised to see that of all these pieces of the pie, that the green transportation piece was only 10%. We've been talking about transportation for years. It's only 10%. It's still important. Every piece is important. Building energy at 8 o'clock, 12%, not big either. So this is the sort of thing we can learn from the literature and from our friends in other countries. Supply chain indeed is the biggest piece of the pie. I think Leslie mentioned that from the top, and you can see pharmaceuticals. The production of pharmaceuticals alone is 22% of the pie. Next slide, please. So we took this information from our academic friends, and we used the expertise that Linda and others at the coalition have had for years of doing the Green Hospital Scorecard. There was a Green Hospital checklist in 2002, the Green Hospital Scorecard starting in 2014, reaching out to 100 hospitals across the country to get information about their greenhouse gases. And then we've simplified it here. This looks pretty simple. This is arguably some of the biggest things that you can do at your facility. It is a low-hanging fruit tree. On the left is a financial scale, a logarithmic financial scale. The orange fruits are the big ones. For a 200-bed hospital in a Canadian context, the orange fruits save over 100 tons of CO2 per year. So again, just like me, if you're going to take this on, I encourage the hospital systems to go after the big orange fruits. If you look at the $10,000 line around the EV chargers, most of these fruits are under $10,000. Energy manager, we have up there at 2 o'clock, $100,000 salary. The energy manager will save that money in less than 1 year, and that is why the financial return on investment is less than 1 year. It's a big fruit in the tree. So these things are financially doable, and we need to learn from each other and take these projects on. Next slide, please. And finally, again, the coalition, long before my time, has been in this space for 25 years. This is a summary of some of the things that we've done over the years, not just the projects that have been taken on, but also so many great partnerships. If you look around here, I don't know if you can zoom in and see all of this. So thanks to all the people who've gone before me at the coalition. As I've said, I am interested in vulnerable populations. Sadly, our planet is vulnerable, and I would suggest that we're all vulnerable now in terms of climate change. There's a lot of work we need to do. We need to work together. We need to work fast, and I'm very excited that HSO Accreditation Canada is part of the team. Back to you, Vishal.
Thank you, Miles. I appreciate that presentation and that call to action. I think at some point you mentioned, Miles, that your talk isn't really helping out with the climate anxiety side of it, but that's okay because our next presenter, Linda Varangu, who I am very privileged to introduce, will be speaking about some of the practical and demonstrable solutions and the key priorities for us to focus on. So hopefully that goes a long way in addressing some of that anxiety. So what to say about Linda? Well, Linda's been empowering healthcare to improve environmental stewardship since the 1980s. She was a founding executive director for the Canadian Coalition for Green Healthcare and co-founder and climate lead of Peach Health Ontario. She is also on the executive committee and a program advisor to the National Cascades Initiative that's creating a sustainable Canadian health system in a climate crisis. She also holds a master's in environmental engineering. Linda, we are so fortunate to welcome you here. I know you're an advisor to our HSO Climate Action Advisory. We can't wait to hear a little bit about understanding some of the conversation and the medical and scientific evidence, the experiences of those on the front lines of the climate crisis. Where should we be prioritizing our actions globally and as healthcare broadly? And what are some effective demonstrable strategies that have been working across the globe? So Linda, I'll turn it over to you. Go ahead.
Thanks so much, Michelle. And thanks again to the HSO for taking on this wonderful initiative that you've got going. So my role is to give you a climate change, climate action crash course in 15 minutes with a climate health lens. So this is what I'm attempting to do today. So hang on, here we go. So we've seen this phraseology, climate resilient, low carbon, sustainable health systems. Next, please. Where does that phrase come from? Well, it originated at COP26 when COP actually introduced health program commitments. And what we have seen now over the last 4 years is a number of countries have now come on board and actually said they will support climate resilient health systems, sustainable low carbon health systems, and move forward on them. There are currently 93 countries and areas that have made these formal commitments. And the government of Canada is one of those. If you're not sure if your country is on there, go to the attached website and you can find if your country is on that site. Thank you. Next. So the WHO has also been really instrumental in giving us some guidance on what can we do to move forward on climate resilience in our health systems and for our healthcare facilities. So these infographics tell a story of how we can actually make sure that we're covering our bases when we're trying to incorporate climate resilience, for example. So the wheel on the left is shows 10 building blocks for resilience in a health system. And I'm not going to go through all of them, but the critical things that I want to mention are leadership, healthcare workforce, making sure that you understand what your climate risks are and what your vulnerabilities are, and coming up with some adaptations for that. Having health, I'm trying to see, having great technologies that will help you actually undertake some of these initiatives is another one. Having financing that's appropriate and integrating these into delivery of healthcare. On the right-hand side, the wheel is telling us to focus on more of the healthcare facility side. And so we're looking at the healthcare workforce, the energy that's spent there, the infrastructure, technologies and procedures. And we want to be able to focus on waste and water and all those things that come from the healthcare facility. So the WHO is giving us some great guidance moving forward on these. Next. So let's talk first of all about climate resilience. What are we doing to prepare for disasters and how should we look at that? Next. This is another great slide that kind of pulls together all the great information that we need to consider when we're talking about climate change and health sensitive risks. So there's three components when we're talking about health risks. There's the vulnerability factors, such as what's your socioeconomic status, their demographic, things like that. What is the climate-related hazard, whether it's extreme heat, air pollution, water scarcity, and what the exposures are. So these three things together indicate what the health outcomes could likely be. And on the bottom kind of bar there, the health outcomes show us a number of different health impacts, and Miles went through those in a chart that he showed. But I'd like to point out here that two of these, and that has to do with the respiratory system and the cardiac system. CIHI, Canadian Institute for Health Information, has told us that of the top 5 reasons for hospitalizations, 4 of those are respiratory and cardiac. So we should be getting ready to expect more patients coming into the health system with those significant issues. So if we have more people coming into the system, we will also have impacts on the health facilities and the health systems in general, including primary care. So this becomes a community issue as well. And so we see that climate sensitive health risks play an important part in this. Next, please. So if we're looking at what the climate health risks could be, and Miles pointed this out as well, the number one issue that all of us have to deal with is the rise in global temperatures. And this diagram here shows us the change in temperature from 1951 to the 1980s, which would be the dark blue, to what our temperatures are now. And so we're seeing places that are 6 degrees higher than they were a number of decades ago. That's pretty frightening and happening pretty quickly. And we know the last 2 years have been the hottest on record. We also know that we are now above 1.5 degrees, which we have committed to, which a number of countries had committed to at the Paris Climate Conference to not go above. So we're going to see some critical changes. Next, please. The other big incident of climate disasters is in the flooding. This particular analysis indicated that 1 in 12 hospitals around the world will be at high risk or total or partial shutdown. And most of the scenarios that they're facing is in the flooding area. So that's something, if you are in an area that has high rains, in a coastal area, that's something that you also need to be concerned about. Next, please. So what are some of the climate-related impacts that we can look forward to in the health system and our healthcare facilities? Many of these on this list we got from our Green Hospital Scorecard surveys, where we were asking people, what have you experienced in terms of climate-related impacts at your facilities? Infrastructure damage was by far the most frequently reported. Power outages, no longer access to potable water because of the flooding, significant supply chain interruptions, whether it's on the medical side, medical product side, or non-medical, increased in hospitalizations, healthcare workforce impacts, having delays in the delivery of healthcare services, lots of transportation interruptions during these patient evacuations, and on. So this list could go on and on, but this is just a flavor of what we're trying to give you. Next, please. So what are the possible actions and what are we starting to see out there? If it's an infrastructure issue that you know you have because you've done your analysis, you have to deal with your deferred maintenance. A heavy storm can take your roof off in no time at all. So that's something that you really need to consider. Examine local low carbon energy sources is another thing that many hospitals are starting to do. Storing some potable water on site. Focus on reusables where possible and local to actually not deal with the supply chain issues once they start happening around the world. Because when we're talking about the supply chain, it might not be a disaster event that hits us. It might be on the other side of the world where that product is made. So that these are things that we need to start considering. We need to train our healthcare workforce on emergency procedures. prepare for the patients that we're going to be expecting, and having emergency plans with climate lenses. So these are all examples. One of the other important things I just wanted to mention is it's so important to work with your community and your community stakeholders to develop joint climate action plans. Next, please. Priority steps. We'd like to make sure that people take these into sincere consideration. We've got to understand what our climate risks are for our areas, undertake vulnerability assessments, and then identify what your adaptation plans will be. Undertaking scenario planning and testing what you actually identified as important vulnerability issues and what your adaptation issues are. So next, I'm going to actually slip through a couple of slides here. Next. So just to actually focus now on the greenhouse gas emissions generated in a healthcare facility, where are these coming from? And I just wanted to point out next that the greenhouse gases that come from a facility are actually divided into direct. That means that the facility is generating those, or that they're kind of generated by the supply chain, which Miles pointed out. So let's go to the next slide. And we can see that different organizations are collecting this information differently, but we're always seeing that there's a big chunk on healthcare facilities, big chunk on pharmaceuticals, big chunk on various other supply chain issues. So next, please. So what is it for Canada? The consultants Dunsky have done an analysis for the Canadian healthcare sector and identified for us where our emissions are coming from. The direct emissions are about 27%, and that includes the natural gas, the heating oil, the medical gases, and the vehicles that we're using. The other chunk, besides electricity, which we call indirect scope 2 emissions because we don't have control over them, is that we have a significant greenhouse gases coming from the supply chain, from commuting, foods, waste, and drugs and care. Next. And so they've also identified for us what the drawdown is. And so how do we take steps to actually eliminate or get rid of those emissions? LED lighting, they're saying, heat recovery, fossil fuel switching out, and medical gases, and ambulance. These are all steps that they're recommending that we take across Canada. Next, please. And what they're also telling us is that business as usual will cost more, 38% more, if we don't undertake these changes now. Next, please. The other aspect is the supply chain. And at the NHS in England, what we're seeing there is that when they are focusing on the supply chain, they are focusing on medical and non-medical products. And those are the two bars on the right-hand side. So that's how they're going to propose to get to their net zero by 2040. They have a whole bunch of drawdown pictures and something that we can really learn from. Next, please. So low carbon energy, sustainable energy sources are something that we should be looking at. Eliminating desflurane and centralized nitrous oxide, shifting to low carbon inhalers where possible, energy efficiency, conservation and heat recovery, transportation, and tracking and setting targets and reporting. Next, please. On the indirect emissions, we're looking at preventative health, keeping people out of the health system to begin with, low carbon care like telegreen healthcare, telehealthcare, sustainable low carbon supply chains, working on that, sustainable prescribing, local sustainable plant-based foods, waste and water conservation, staff engagement and education, shift investments from fossil fuels. Those are examples of what some of the actions we can take on emissions. Next, please. And I'm just going to skip through this one and the next one. And just to get to this question, if you're wondering if reducing our health system greenhouse gas emissions will impact global health, population health, the answer is no. Next slide. Because the Lancet has told us that they've done this analysis. where we're seeing the Human Development Index, which is shown by the different colors of the dots here. The healthcare emissions per capita is shown on the bottom. And what we're seeing is that the folks that are in the very high development country zones are actually using much more emitting much more greenhouse gases per capita than is needed, because a lot of the folks that are closer to the under 500 greenhouse kilograms of CO2 emitted per patient are actually providing us with good healthcare because they have a very high life expectancy at birth. And so that's one way of tracking that. So I think this is it for the Crash Course 101. And thank you so much. Bunch of resources from the Canadian side. And thanks so much. And over to you, Vishal.
Thanks, Linda. I appreciate that crash course, as you called it, into this area. And I think that if anything, the presentations by both you and Miles really demonstrate some of the complexity involved in this work, but also the simple solutions that are possible to contribute to where we want to go. Just recognizing where we are at time, we have received a tremendous amount of really fascinating, very compelling questions, ones that I wish that we could dedicate more time to in separate webinars, which I'm sure we will in the future. But the one question here that I find is really fascinating, I'm hoping that the three of you can provide some insight into, is that we've got one individual asking, they hear and they understand the complexity of these issues. Miles, I think you outlined it very, very clearly. I think, Linda, you've also articulated from a systems perspective how can systems kind of contribute to addressing the climate crisis. But at an individual level, at a one-to-one level, when people leave this webinar, what type of actions do you encourage at an individual level someone can do working in the healthcare sector? And then Leslie, if I can ask you to comment at the end, because you did note that you're on your learning journey, as you are learning, maybe some reflections on your process and your learning around this area. But maybe Linda, I'll turn it over to you first. At a one-to-one level, what do you think about some practical things someone can do after leaving today's webinar?
If you work at a healthcare facility, I would suggest engaging with your green team or your sustainability team, because the thoughts and ideas that you can bring to them from your areas of expertise are really, really important for them to move forward on. And I think there's a lot of people on this call that probably do quality and safety. QI projects, use your QI projects to actually identify some opportunities for new processes, new systems that you can put in place that are lower greenhouse gas emitting in any field that you work in. Those are a couple ideas.
Those are good ones. Miles, from your perspective?
Yeah, so I work at a hospital within Hamilton Health Sciences system, and it was before COVID that we started a green team at the hospital I'm at, which is a 220-bed hospital. I'd been there a long time, so you know a lot of people, and I suppose I was just kind of asking around who's interested in this kind of thing. We actually started with the tree planting at our site, and then on the Saturday you find out who's interested to come out, and we talk about other things we can do. So that is what I would call a grassroots green team, which is important. So as Linda says, if there is a green team already, then join it and see what skills you can offer. If there isn't one, maybe you can find some friends at your facility and start one. And then a big impact item is if you can get to a top-down corporate green team, and can you move any levers up there to make a corporate green team where some of the really big changes can happen.
Thanks, Miles. And I will just note for anybody who's on the call who belongs and is part of HSO's green team, expect some emails right after this based on Linda and Miles' recommendation here. Leslie, I know that you had mentioned at the top that you were on your own learning journey, which I think is, a really important thing to hear from our leadership. But I'm wondering, as you are coming across new ideas, new ways of thinking, just reflections on your learning journey.
Thanks, and thanks so much to Linda and Miles for the kind of incredible presentations. I think the learning from me, both from where I sit today and when I reflect on, having been a former hospital CEO, and just thinking we have to find ways to kind of break it down to what is possible within our sphere of influence while staying ambitious. And that sounds a bit almost contrary, but I think that that's where I try and sort through, and that's where I'm really hoping and looking forward to the advice of
J'espère, et j'ai bien hâte d'entendre les conseils
advisory committee for us.
du comité
How
consultatif.
do we zero in on
Comment
what are the choices that we can make as with the levers of change that we have that can make a practical, meaningful difference without kind of overwhelming people at the same time. And that's a very real dynamic, especially when it comes to the world of standards and accreditation, because people already feel overwhelmed by all the things that we ask them to do. And they are all individually really critical. And yet we have a responsibility to kind of sift through that, have things come across as clear, connected, practical, and evidence-based. And so I look forward to learning kind of how to sort through some like all the all the pieces. And also, I think the other part of learning for me is discovering that there are many, many people and players out there that are trying to do kind of their own thing. And while the grassroots piece that Miles you spoke to, engaging and involving at a very personal level, is important, I hope that in some ways we can contribute to the accelerated learning so you don't have to reinvent the wheel, and that there can be some unified efforts across Canada that can also transcend around, which is why we're really advancing the kind of partnerships that we are, so that there can be a Canada way. Someone in the chat asked, do we have Canada standards? Well, we're working through those right now. What exists? What doesn't exist? Where are the gaps? How do we incorporate those into our standards and others? And then looking at where we can collaborate to make a difference together. So I'd say keep learning, but your own self to be able to interpret and filter some of this, but also rely on, as we work together, we can rely on each other for the great work that's going on around us as well, and zero in on let's make as much of a difference as we can for Canada and Canadians.
Thanks, Leslie. And as we kind of draw this webinar to a close, I also just want to thank Miles and Linda as well for agreeing to host today's webinar and for kind of filling us in a little bit. I think there's a lot of conversation happening around climate crisis and how different sectors and different interest holders can contribute to climate action. I think at HSO and Accreditation Canada, we're extremely grateful to have been on our learning journey. And I think the declaration and the action plan that is within that declaration articulates how we are going to be holding ourselves accountable to contribute our levers of change to addressing the climate crisis. I am encouraging everybody to take a couple of minutes, take a look at the declaration that's now in the About Us section on the HSO website, because we really do feel that our commitment to climate action, similar to our commitment to cultural safety, is really about who we are at HSO. So please feel free to take a look at that. And in just a couple of minutes, you'll see a little survey pop up on today's webinar. We do hope to continue to host webinars on the topic of climate action. So please, if you have a few moments, complete the evaluation that will be popping up. And again, Miles, Linda, Leslie, thank you so much for the time today. And we look forward to continuing on this journey. Thank you, everybody.
Thank you. Thanks, everyone.
Thank you.